do these nurses even do safe? Like, what do they do? Like, what's their work? If you've asked yourself that question before, or if you've asked someone, or if you've just been wondering, like, what do these nurses even do? Really? Alright, so you just stumbled upon the right video this good day. And today we are going to be exploring what nurses really do in the hospital. We are curious to know, aren't we? So what do nurses really do in the hospital? Sit back and relax as we unfold. Welcome back from the short break. This is Nursing Moment with Sharon. My name is Bukola Sharon Idol and I am your host. Alright, so we are getting right into it. What do nurses really do? No, like for real, what do nurses really do? Okay, so to answer that question, I see a lot of misconceptions generally, and that was actually the motivation to making this video. I see a lot of uninformed assumptions and misconceptions flying about from people, even on social media, on Twitter. Twitter is a very crazy place, and you see all of this very wrong misconceptions, and a lot of people obviously do not really know what nurses do. Okay, so I hope this video educates us, informs us more, and clarifies some things we have in our minds. Alright, so we are getting right into it. So before we can really answer what nurses do in the hospital, or what nurses do generally, we have to first ask ourselves who a nurse is. So who is a nurse? A nurse is a person who has graduated from a nursing program and has met the requirements outlined by the country's licensing body to obtain a nursing license to practice in that country, right? So a nurse that has not gone through all of these processes, or a person that claims to be a nurse and has not gone through all of these processes and is not licensed in the country in which she claimed to have trained, is not a nurse. Okay, so now that we know who a nurse is, now what do nurses really do? So what nurses really do is really not stereotyped and is really based on different practice settings. So depending on the different specialties, we have diverse specialties in nursing, and depending on different specialties, this tells us what your job as a nurse is, what your role as the nurse is. Okay, so but generally speaking, we are just going to go through, for the purpose of this video, we are just going to go through, outline a quick rundown of the general things a nurse does. So number one, I would like to start with the basic. A nurse assesses and takes the history and takes detailed history from every patient that is to be under her care, that is to be admitted, that is received into the hospital. There is an assessment and there is a detailed history taken, separate from the medical record, separate from the other members of the healthcare team records, from the doctors, from the lab people, from wherever, separate from. The nurse has his or her own detailed documentation of the patient history and the patient's condition. Okay, so we have the Gordon's functional health pattern that we, okay, well, that's jargons, that's nursing jargons. Okay, so let's leave nursing jargons for nursing jargons. Yes, so the nurse assesses and takes detailed history of every patient that is to be admitted under his or her care. So moving on, the nurse listens to the patient and their emotional needs. So beyond all of those things the patient sees, beyond all of those things you see as a patient and You express yourself in words, how you are feeling, how the symptoms started, when they started, your present complaints, and all of that. Even beyond the words you are saying, there are still subjective data that are collected by the nurse, and the nurse assesses your emotional feeling, and we have our own diagnosis, and sometimes we diagnose you of anxiety because you feel like, because we know that you feel anxious, and probably by asking a lot of questions, or by feeling nervous, or by the unknown outcomes of whatever ailments that may have been diagnosed medically. So all of this ability to assess a patient holistically, not just limited by what the patient is saying. Okay, so these are these are among, but not limited to, what nurses do. Right. So I'm very sure some of us may have, a lot of people watching this video may have sorry tales associated with maybe or maybe not nurses, encounters with maybe or maybe not nurses, because I really don't know, because I was not there, but I really hear some of these tales and I'm quite sympathetic. And but then these are what nurses really do in the hospital. So take away the toxicity, taking away all of those other factors, you see that nurses advocate for the patient. Nurses, it is the nurse that you can talk to, and okay, maybe you feel like you are not okay with the kind of treatment, or with what the managing team is. It is the nurse that you will talk to that would advocate on your behalf. So the managing team, or whatever your complaints are, it is the nurse that represents you as a person, as the patient. Even in your food, your choice of food, you probably have a preference, a personal preference at home. The nurse will tell nutrition the nutritionist to bring this kinds of food for these kinds of patients. So in all these ways, advocacy is done. So the nurse is your advocate, the nurse is your confidant, the nurse is really the person to talk to. So moving on, let's just like I said, we are just outlining, right? We're just doing a rundown what nurses do in the hospital. So the nurse also coordinates care with other members of the healthcare team, including the doctor, the lab people, the excuse me, the nutritionist, the pharmacist, every member of the healthcare team. The nurse collaborate care with them. So you cannot plan care. You cannot plan the care of a patient without the nurse, right? Because the nurse is the caregiver. The nurse is the person to administer that care. The nurse has to create his or her own care plan for that patient, right? So the nurse is also your counselor. The nurse also health educate you when you come to the hospital. A lot of times, other members of the healthcare team may not even have all those time to give you any long detailed summary of what, except you really need the serious counseling. And but if you just want to ask a question in passing, or you just want to ask something you're not clear about, the nurse is your go-to, because the nurse is always there, right? It's always stationed. A nurse is always stationed to a patient, whatever the case, no matter how short-staffed and how practice and how toxic the practice setting may be. A nurse is always stationed to the patient. That is just it. It may be one nurse to 50 patients. It may be one nurse to 25 patients, but there always has to be a nurse. And that is why sometimes total nursing care may not be actualized. But that is going to be definitely a topic for another day. Well, basically, the nurse is always present. So the nurse is your go-to. The nurse is the person to help educate you, to counsel you, to tell you all you need to know about whatever question you may have. So what else do nurses do? Nurses also have to stay current with healthcare practices, with healthcare developments. They have to stay current with it. You cannot just be basing your facts, be basing current practices on what you've learned or where you graduated from so many years ago, over 10 years ago. You're still no. So we currently update our knowledge base, we develop ourselves, we get certified, and you see that okay, you keep getting promoted and promoted and promoted. And okay, even in the patient care, the vital signs, it has to be up to date. You administer those medications, you monitor this patient holistically, you monitor their intakes, you monitor their output, you have all your charts, you organize the ward. Those are many. Those are among but not limited to what nurses really do in the hospital. So it is not just all about, a lot of us just see anybody, really anybody in a hospital wearing a uniform, and you assume the person is a nurse. Or you just go to a private hospital somewhere, and the first person that opens the door to you and is doing all of that and is carrying a blood pressure machine, and you say that person is a nurse and that person is rude to me. So beyond these misconceptions, let's start patronizing registered nurses, not just so-called nurses. They're not even nurses, they are quacks. So let's just put an end to quackery, embrace registered nurses, and let us stop attributing all of these negativities and all of these toxicities to the nursing profession. Really, nurses are the people that you can talk to in the hospital, and we have a lot of us also have good experiences, but it's just quite sad that the bad experiences tend to overshadow the good experiences, right? So beyond the toxicities and all of that, nurses, I'm very sure this video should have given you a further insights to what nurses really do in the hospital. Yeah, so if you've been asking yourself the question, I hope we were able to discuss some of those points and many more. You can add to the table, or if you have any questions, you can put it in the comment section. I will be happy to attend to it. You stayed till the end of the video. Oh, thank you so much. Thank you very much for staying true, and it was quite a conversation, and I don't want to stir up emotions in some of us right now, because a lot of times when you hear really cruel things about nursing, it sparks up emotions, and you really feel like, no, this should not be happening. This should not be happening for a profession that I devote such time and such energy to, and it is still this bad experiences that people keep carrying about. No, we don't want this anymore, right? So as nurses, we should also learn to be emotionally intelligent, not just always giving into our emotions and transferring aggressions to patients or what have you. Or some of these things are really personality issues anyway, and not a profession thing as commonly misconstrued, right? So thank you very much for staying to the end of this video, and if you are yet to subscribe, of course you know what to do, and if you are yet to like, you know what to do. So thank you very much, and we'll see you on our next official video. My name is Bukola Sharon Ayo. Once again, this is Nursing Moment with Sharon, and remember, a nursing moment, every moment counts. So see you later, and have a beautiful week. Bye.